What raised our interest was last year when we were here in Hot Topics, we saw a poster from Japan wherein interventions were being offered for babies born with this condition. And to the best of our knowledge, in England or in the United Kingdom, we did not offer any intervention. So we went back to look at, is it worth doing it? It raised a lot of ethical questions. And when I looked at the literature in pediatrics, 44% of interviewed neonatologists said they would offer some sort of resuscitation for these babies. So we were really curious and very interested in seeing, is it really worth? Is it ethical? So we looked at our population. We have an excellent population-based data in Wales. So we looked at outcome of these babies for the last 10 years without any intervention, and we found that unfortunately these babies don't do very well, and most of them die in their infancy. And then the literature in the world where interventions were offered showed all you were doing is prolonging life. So then the ethics of it comes in. Is parental autonomy greater than the best interest of the child? And that's the debate the poster is hoping to generate. So the design was a long-term observational study. So it was an outcome looking at what happens to these babies, just simple epidemiology of these babies without interventions. Locally in Wales and hopefully in the United Kingdom, it reinforces the message that we always want, that while parental autonomy is important, I think in ethics, the baby should be, the long-term outcome of the baby and the best interest of the baby should supersede any other ethical debate we might have. And we are hoping that maybe in a wider audience, hopefully the neonatologists here in the US would again look at our data and think, should we really be resuscitating these babies? Should we really be offering intensive care? And actually questioning their own practice. That's what we're hoping to do by highlighting this study. I don't think there's any further research to be done in this field, in the sense, unless there's a breakthrough in some sort of genetic kind of intervention that could be done. But there are conditions like Down syndromes where people do accept that children with Down syndrome and adults with Down syndrome have reasonable quality of life. But we are not there yet in trisomy 18 and 13, and until there's a breakthrough, I don't think intervention should be a standard until we see some sort of breakthrough, I believe, in long-term survival. And if that happens, yes, there are some research to be done.